Assalamu alaikum wa rahmatullahi wa barakatuh. Playing on your screens is your program Health Check, a program where we give free medical advice, but still advise you after taking the advice from the medical personnel that we bring to you, you still need to see your personal medical doctors for more advice. Your host today is Nambale Bashir. And still, just like in the previous episodes, we are still discussing mental ailments. And the topic of discussion today is habituation. What is habituation? I have Dr. Baker Akaturinda, who is about to explain to us what habituation is. You're most welcome, Doctor.
Thank you, thank you.
Dr. Baker Akaturinda.
Yes, sir.
We need to know what is habituation.
Sure. Yeah, thank you once again. I'm happy to be back. Habituation is defined as a diminishing of an innate response to a stimuli. I can explain it in a simple way as saying, what has been disturbing you, this time no longer disturbs you. The response that you have been having to a certain stimuli gets time and diminishes. You no longer feel. An example is, if you have been in the village and they bring a machine, say for crushing cereals, crushing maize and millet, and anytime they put it on, you feel disturbed, the noise is much for you. At first is noise. It takes there 3, 4, 5 days. Later you get used.
It's normal.
The noise becomes normal now. No longer noise becomes sound.
No longer a problem.
No longer a problem. Even if you put it on, you don't feel disturbed. You can do your things normally. So that is what you call habituation. You later get used to a stimuli or something going on. It no longer disturbs you. Now you concentrate on others, but that one becomes normal to you.
Okay.
So you get habituated to a stimulus.
I need to remind you that this program is meant for you. So later on, we shall have an interaction with you, our viewer down in the streets of Kampala. We need to see your views. We need to know if you have any questions, and our medical advisor or our doctor today, Dr. Baker Akaturinda, will help in one way or the other. Dr. Baker Akaturinda, this now brings me to the causes of this mental disorder. What are the causes of this mental ailment? Habituation.
Habituation, yes. Habituation, all of us have it.
Okay.
Because all of us respond to different stimuli.
We are victims of this.
All of us, yes. And I may not call it disorder, but it is a psychological, it's a mental response that happens to all of us. As we shall discuss later, we shall find it has advantages and disadvantages. The factors which impact it, or factors which influence it, among them is frequency of a stimuli, of a stimulus. For example, if you have been hearing a machine at a certain level, later they increase the sound. Now, much as you had been comfortable now with the sound, now you become uncomfortable. You say, now that's too much, because they have increased the frequency of the stimulus. So the increase of the frequency will change your habituation. Whereas you were fine with it, now you begin complaining. Then also the intensity of the stimulus, because at a certain level, your brain had gotten used.
Yes.
Now when they change it, now you get an issue with it. Until you continue at that state, then you later get used also. So the frequency and intensity can be an issue there. Then also change of the stimulus. For example, if you have been hearing the machine making noise, and now you hear now a person crying at a high rate.
Instead of a machine.
Instead of a machine. Now the stimulus has changed. Now you say, who's that one making noise for us? Who's that one? Because the stimulus has changed. So you will now react to this one because you are not habituated to it. So the change of the stimuli, the change of those stimuli will make the habituation change. Because you get used to one thing at a time, when something else comes, you will not have gotten used. So you will get disturbed. You will get disturbed and the response now changes. So the factors are the intensity, the stimuli, and the frequency,
Okay.
and even the change of the stimuli itself will make habituation change.
If you say that all of us have this mental problem, I find it very complicated. What complication does it come with?
Exactly. Now, like I will say, this will affect the way of living. I'll give an example. Because remember, we are discussing habituation.
Yes.
And it is the diminishing of the response to a common stimulus. I gave an example of the machine, but let's come to terms of work, job. You have been coming to work and you are given, say, money and maybe some food. The more they keep giving it to you, you later get used to it. It no longer makes sense to you because you have been having it several times. So in case of that, you get what you call boredom at work.
Okay.
Boredom. It no longer moves you. The 1 million they could give you and you say, thank God you become happy. Now no longer moves you because you are used to it. So because of this habituation later causes boredom at work, at workplace, and less productivity. Because now there is nothing new. You have seen it all. You have gotten that 1 million, you have been getting it. You are no longer interested. Even if they give it to you, you see it as, this is not important. Because you are habituated to that motivation, that 1 million,
Yes.
or that thing. Then also, I can't forget to talk about the relationships, say in families. I'll give an example, moderator, I'll give an example. Say you are married.
Yes.
This lady will see you at first as an angel, you know. She's looking at you, you are new in her life. She has a husband, she has in local language they call it mogole here. She has a new groom. She looks at you, you are, whenever you come, she feels like hugging you.
And makes promises that you'll never
I will love
fulfill
you,
even.
exactly. I will never disappoint you,
I love you till the ocean's dry.
Exactly. Now her eyes have been seeing you often and often and often.
That's when she sees that you have a big nose.
She becomes habituated. Now she begins seeing the bad things on you. She becomes, no longer matter because now she's habituated. The response, what we define it, the response to you has now what? Diminished, has gone down. You are no longer matter. You are no longer an issue.
Okay.
She's used to you now.
Yes.
So that brings also challenges in relationships. We talked about boredom at work, but now here in relationships, in our families, or in friends, you see them as now nothing. They no longer matter because they are now used to them. So it becomes a serious complication to this habituation. A serious complication, yes.
Thank you so much, Dr. Baker Katurinda.
Yes.
Now we need to know, how does one find out that such and such a person, the rates of habituation are getting high or are high already?
Exactly. Now, one, you'll see it on the response of the person.
You're talking about the symptoms now.
Yes, yes. Because we shall know it by the symptoms.
Yes.
If a person has been, say you are the husband, and you have been coming home and she rushes to come and hug you, this time she will say, you are welcome. You sit there. Your seat is there. Thank you for coming.
If you are hungry, you know where the kitchen is.
This goes across both of us, even
Yes.
us men to our women, our wives.
Exactly.
Yes. You saw her as a darling, as a dove, because you had just seen her. Now, she no longer matters because now you are used to her. You know her figure, her face, her nice smile. You are now used to everything. So you can, now this person is habituated now to me. Then let's come to workplaces or society. You get a president, for example, or a leader, At first, he wants to work for you.
Yes.
Work for you because now the office is, the response, his response to office is still high. He's not used to the office. Later, everything becomes normal. Even if he doesn't work for you.
After all, the salary is coming
Salary
in.
is coming, even if you are his people. So the person gets habituated. Now, this now brings another symptom. Productivity becomes reduced.
Okay.
Because now there's no longer response to a stimulus. The stimulus being the workplace no longer matters. Is now used, takes things for granted, and all is well because now everything is now common to him. He's now habituated. So when you see such symptoms, such things, you see a person who was now active, no longer cares. Person who was caring takes his time. Person who was producing at this rate now produces at a lower rate. Then you can tell that there is habituation here. This person is getting habituated to this situation. Those are the signs you can tell, the situations you can tell that a person has habituation or is developing habituation.
Okay, Doctor,
Yes.
thank you so much. Since this program is meant for our viewer, our cameras flew all the way to the streets of Kampala, and we need to see where and to who did they land exactly to see the views they have and questions in case they have any to you, our doctor. Let's see who we have today.
I'm Mutiwa Abdurrahman from Kampala, Uganda. My question is, how can someone get habituation lessons? What does the doctor say about that in the studio?
Mutiwa
Yes.
from Kampala is asking for lessons
True.
regarding habituation.
Okay, thank you so much. This person asked this question. It's very important and very nice. Habituation lessons. Because if a person doesn't have them, he may not tell whether he is having the habituation or perhaps his workers have habituation. Or even a spouse, or even friends, or even children. Anybody can have this. So I can advise this person to go and see his or her counselor or come to hospital for counseling sessions, or you can get motivational speakers, because this is, although it's part of medical, but it's purely a counseling session. In the lessons of habituation, there's no need for medication. There's no syringe there. There is no injecting. There's no tablet.
No vaccine.
No vaccine, no nothing. It's purely counseling and educating a person about habituation. So a counselor can do it better. I can advise your viewer to go and see your counselor, or come to hospital, or attend, or you can view lessons online of known public speakers, of non-motivational speakers, or even known counselors. There are counselors who are on YouTube and everywhere. You can attend and listen in and pick lessons. You know how habituation comes. You know how to go about with it, how to cope up with habituation, how to manage it. If your workers have habituation, how do you manage it? Like that. So you can advise and say, seek counseling from your counselor or a doctor or motivational speaker.
Thank you so much, Doctor.
Yes.
We all have habituation. That is no longer something to worry about.
Yes.
We have it. But when it accumulates to the highest level, it becomes a problem.
Sure.
We have a brother, sister who is at that level, at a very risky level. It is irreversible, let me say. That's what they might think. How does one cope with it in case it has reached that level that is very worrying?
Yes. When habituation is at a higher levels, you need to direct your focus. For example, okay, we say focus on the positive. Example, you are working and you feel you are used now. You no longer get sense coming to this studio to present. You feel, I've presented enough. Now you can decide to look into what you are doing. What is it helping you? Which positivity are you getting from it? So you can direct all your energies on the positive. then you will now be productive. I also can mention about taking a leave. You can take a leave for 1 month, or the company can give you a leave. So if you are the employer, you can give your employees leaves. That's why in organizations they have annual leaves, because a person will be bored with the work, will be habituated. Like for us doctors, seeing patients every day, you get tired.
You need to see another world, a different world.
Exactly. You go for outing, you have some month, you go visit the national park, Queen Elizabeth, you see those, Uganda cobs, you see different environment. You change on the response, on the stimulus. Now you are seeing, instead of seeing patients, now you are seeing animals. So you get refreshed. By the time you come back, you feel like you want to get now, you feel you are beginning afresh.
You are very energetic.
Exactly. So those breaks are very important in managing habituation. Also, we talk about motivational modes, or you can say motivational ways. If you have been giving me a salary of 1 million, you can give me 500 as a just, not a salary, not part of the salary. But man, thank you for working. Thank you.
Have this token of appreciation.
Exactly. It's not on the agreed salary, the usual salary, the usual wages I'm getting, the usual wages you're giving your workers, but it's just appreciation. Once in a while, it is abrupt. The response becomes high. They say, wow, I should now
work. So bosses, because you said someone with habituation, productivity becomes low. So if you want more productive workers, a boss, you need to motivate your workers with something. Something interesting.
Something out of the schedule.
It might not be money, maybe a Christmas gift, maybe a Eid gift, something like that. Some awards.
A trip to Mecca. You can surprise your workers, say, this month we're having 2 best performers to Mecca.
Let's now visit the tallest mountain in East Africa.
Exactly.
Let's now visit the largest lake on land.
That's on the employer. Even you personally, you can decide to take yourself out,
Yes.
As a person, you say, but Dr. Baker, I've worked a lot. This weekend, I'm going to Kasese, Queen Elizabeth National Park. Or I'm going to visit Mount Rwenzori. Put your own money and you go. By the time you are back, when you are fresh.
Different person.
Exactly.
Fresh mind.
Fresh mind, fresh everything. You begin like from a new start. You become very productive. Even in a family, you can decide to take your family out. You say you have, because remember we talked about difficulties in relationships and families because of habituation. Every day eating on the same table, same bedroom, same sitting room. Every time same plates. Now you say this weekend, madam, with our children, we are going to Serena. Take them there. It will be the same food, the same meat, but a different environment. The response becomes different. They will feel more happier than when they are home. So it can help them to manage this habituation. When you are back, they will feel like, yes, that is good, that is caring for us. Much as we have been caring, but now the different environment can create something different. I also can't forget to talk about, I mentioned the motivation, but also change of environment or change of ways. That's why companies have annual reports. How have we done best? Where have we done best? Because if you see some department, the productivity going low, perhaps the workers there, the staff there, have gotten habituated to what they are doing. Now you can say, we are changing schedule. You are working in the morning, this time you're working evening. So you adjust somewhere, somehow. So adjustments in the environments and schedules can help manage this habituation. Sure.
Early in the program, you told us that there is no vaccine, there is no drugs, taking of drugs or tablets. There is no injections that is going to help you overcome this ailment. You need just to be a social animal, just as you were created to be so. You need to interact with people, you need to go out, you need to refresh your mind. So that's the medication that you can give us in as far as this mental ailment is concerned. So I'm not going to ask for the treatment. outside that. I'm just going to ask you in case you have any concluding remarks because time is calling us off.
Sure, surely. Thank you so much, moderator.
Yes.
Our viewers, habituation is real. What you have to do is make sure in your daily activities you motivate yourself in a different way. Have social events, attend them, have time with yourself to have fun. Fun is very important. Personally, me, I like music, so it is very important. If you like music, there is a concert, go and attend. Have fun, enjoy. You come back when you are fresh. I also not forget our touch with our Creator. If you're a Christian, go to church. If you're a Muslim, go in the mosque. Don't miss. Attend. You get refreshed with the environment. Otherwise, if you get habituation, you will not be productive in what you are doing. Even in your families, you will face challenges because things will be so common to you that you won't bother, you won't care again. So have some changes in yourself, positive changes, positive thinking. Check on your counselor, discuss with him about habituation, because here we didn't have enough time to expound everything. But when you have your time with your counselor, you can sit for 3 hours, discuss, share habituation, and can be very important for your health.
Thank you so much, Dr. Baker Akaturinda. Indeed, we missed such advice from a person or a qualified personnel like you. This is health check for you. I think we have checked your life well and digested your needs regarding the topic of discussion today, or your inquiries regarding the topic of discussion today, which is habituation. Fortunately, we have more episodes to come that we're going to discuss several elements besides the mental ones. Unfortunately, this one has to come to an end, and I have to call it off because I failed to keep a positive relationship with time. I remain your host, Namba Ali Bashir, and until we meet, Assalamu alaikum wa rahmatullahi wa barakatuh.